Hi, it's Dr. Kristen Reynolds with Forum Health in Mequon and Brookfield. I am going to be performing an IOT treatment, Intraosseous Therapy, which is a procedure to help relieve back pain. And I've got a 36-year-old female here who has a history of a hit and run car accident and subsequent back pain on and off for many years. And she's tried a lot of the good things throughout the integrative and functional medicine world without relief, and so we're going to go for IOT today. So intraosseous therapy basically involves a procedure where we numb up the area above, it's called the posterior superior iliac spine. If you put your hands on your hips, it's that bone that you feel with your thumb. We're going to numb that area up, and I actually can go in with needle into that bone, that superior iliac crest. And just going into that bone with the needle is a pressure valve being released for the back pain. And let me explain that a little bit more. There are microvessels that feed the spine and take toxins away from the spine from cranium to sacrum. Those microvessels get plugged up with inflammation in the setting of chronic back pain. And so by doing this intraosseous therapy where we go into that posterior superior iliac crest, it's just like that pressure valve being released and taking that inflammation down almost immediately. We do another technique where we're able to pull up a little bit of fluid from in the bone and mix that with a solution of some lidocaine and a tiny bit of steroid and sterile water, and pushing that back in is the second way in which this tends to be therapeutic. And the third thing that we will do, if we're able to, is then infuse some ozonated saline to help cleanse the spine from head to toe. And my training has shown that it's very effective for people with back pain and other pain conditions. And complications are incredibly uncommon and occur in less than 1% of IOT procedures. And it's actually a very comfortable procedure. So I don't like pain. I don't like my patients to have pain. So we're gonna make this really pain-free for our patient today. So I'm gonna come over here. I've already got her prepped. I've already found the area that I wanna go. I've got my tools here. She's cleansed. You can see where I'm going, right over the posterior iliac spine. I'm going to start by taking a little bit of numbing medication. And if I wanna make this even more comfortable for her so she doesn't feel a thing, I am gonna go and squirt a little bit of this cold solution on you. Okay, so here's my touch. Here's a little bit of freeze therapy. It's cold, I know. And it's running out, but there we go, a little poke. You okay? Mm-hmm. Okay, and then a little bit of numbing. All right, you're doing great. Are you feeling okay?
Yeah, I don't feel a thing.
Excellent. We'll just kind of fan it out there along the periosteum, which is the bone that we're going to go into. So again, now going in, you should be numbed up, but you let me know how you're doing, okay? Mm-hmm. And a little bit of a poke. You all right? Mm-hmm. Okay. Did you feel that?
Not really.
Not really. Okay. So she should be numb. Doing great. And you just keep me posted on anything at all.
I don't feel like the poke or anything. It just feels like there's a little bit of pressure.
Pressure. That's common. So you can see now I'm able to pull a little fluid up. How are you doing?
Good.
Sometimes people will feel pressure just pulling the fluid. And then we mix this. This has got the sterile water, a little bit of lidocaine, and a tiny bit of steroid. And then slowly, I'm going to put this in, and you keep me posted how you're feeling. Any change?
No. A little bit of pressure.
Okay, I'm going to slow down then. When there's pressure, I just slow down a bit. You're doing great.
Thanks.
Pressure, not necessarily pain, but it can still be a little uncomfortable.
Mm-hmm.
So we got 2 of the 3 therapies completed, and even if we had just done those 2, it should be incredibly therapeutic for her. We're going to try for the 3rd, which is the ozonated saline. How are you doing?
Good.
Do you feel anything?
No change, really.
No change.
Feels good, doesn't it?
Good.
Yeah.
Okay. How are you feeling?
Good.
Are you okay to lie here for
Mm-hmm.
20 minutes, give or take, and let this drip in?
Yeah.
We'll keep an eye on you.
Yeah, that sounds good.
Okay.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.